Today, we're diving into a really fascinating condition called myasthenia gravis. It's basically an autoimmune disorder where the super important connection between your nerves and your muscles gets all scrambled up, which can turn even simple actions into a huge effort. Let's break down how that happens.
I want you to just imagine this for a second. What if you woke up feeling totally fine, but as the day went on, things like talking or even just chewing your food became completely exhausting? It's like your strength just drains away. Well, that low battery feeling is the everyday reality for someone with myasthenia gravis.
So, how does this fading signal actually show up in a person? The symptoms can be pretty subtle at first, but they all point back to that same core problem, a really strange kind of muscle weakness that just comes and goes.
A lot of the time, the very first signs show up in the eyes. You might see drooping eyelids or get double vision, but it doesn't stop there. The weakness can spread, making a smile look more like a snarl. Chewing can feel like a serious workout. Someone's voice might start out totally normal, but then just fade away into a whisper. And because it often hits the muscles closer to the body's core, even something as simple as climbing a flight of stairs can feel impossible.
This right here, this quote captures the absolute hallmark of the disease. It's not a constant weakness. It's what's called a fatigability. So a person might be able to hold their arms up for a few seconds, but not for a whole minute. They can start a conversation, but they can't finish it. But then, after they rest for a bit, it's like the battery recharges and the strength comes back, only to fade out all over again. This one clue is often what puts doctors on the right track.
So, we've seen the symptoms, but what is actually causing this bizarre, fluctuating weakness? To really get that, we have to zoom way, way in, down to the microscopic level, where we'll see that the body has literally turned against itself.
Okay, so meet the scene of the crime, the neuromuscular junction, or NMJ for short. Think of it as a tiny, microscopic gap between the end of a nerve and a muscle fiber. This is the critical spot where the nerve's command, contract, gets handed off to the muscle. In a healthy body, this happens perfectly, millions of times a day without you even thinking about it.
And here's a look at how that signal works. The nerve cell releases a chemical messenger called acetylcholine, we'll just call it ACH. This ACH zips across that gap and plugs into special receivers on the muscle fiber, kind of like a key in a lock. When enough of these ACH receptors get activated, the muscle gets the message loud and clear and it contracts. Pretty straightforward, right?
Well, in myasthenia gravis, the immune system makes a massive mistake. It starts producing antibodies that attack its own ACH receptors. So as you can see here, these rogue antibodies just get in the way. They block, change, or sometimes totally destroy the receptors. This means that even if the nerve is sending out plenty of acetylcholine, the message just can't get through properly. The muscle doesn't get a clear signal, and the result is weakness. But what makes the immune system do this in the first place? Well, a big clue points to the thymus gland. This is a small organ that sits up in your chest, and it's like a training ground for your immune system. But for a lot of people with MG, something goes wrong in this boot camp. It seems like the thymus incorrectly trains immune cells to start producing these self-destructive antibodies. So, given all these strange, fluctuating symptoms, you can probably guess that diagnosing MG takes some pretty clever detective work. It's really a process of elimination and confirmation using specific tests that are designed to reveal this very unique pattern of fatigability. The diagnostic process really builds on itself step by step. First, a doctor will do clinical tests to try and bring on that weakness, like asking a patient to hold a steady upward gaze. Next, there's a test called the Tenzelon test that can give a really dramatic clue. A drug is injected that temporarily boosts the acetylcholine at the junction. If the weakness suddenly gets much better, that's a huge sign it's MG. An EMG test offers electrical proof, showing that the muscle's response gets weaker with repeated signals. And finally, a blood test can pretty much seal the deal by actually finding those specific culprit antibodies. Now, here's the good news. While there's no cure for myasthenia gravis just yet, there are several really effective strategies for managing the condition and restoring that nerve-to-muscle connection. These treatments allow people to live full, active lives. The treatment plan is pretty multifaceted. The first line of defense is often a class of drugs called anticholinesterases, which basically help boost that chemical signal. Then, to stop the attack itself, doctors use immunosuppressants, like corticosteroids, to tell the overactive immune system to just calm down. For more severe cases, there's a procedure called plasmapheresis, which can literally filter those harmful antibodies right out of the blood. And finally, removing the thymus gland, a thymectomy, can actually lead to major long-term improvement or even remission for many patients. Okay, so while MG is typically a manageable chronic condition, there are times when the weakness can become so severe that it's a life-threatening emergency. This is especially true when it starts to affect the muscles that we use to breathe.
And this is where things get really, really tricky. A myasthenic crisis is a major flare-up of the disease itself. There's just not enough signal getting to the muscles. But a cholingergic crisis is the complete opposite. It's caused by too much medication, which overloads the receptors until they basically shut down. Obviously, telling them apart is absolutely critical. That same drug, edrophonium, provides the answer. In a myasthenic crisis, strength gets better. In a cholingergic crisis, it actually gets worse. Getting this right can literally save a patient's life.
And that brings us to our final thought. Myasthenia gravis is a perfect, if really unfortunate, example of precision gone wrong. It just shows you an immune system that is so sophisticated it can target one single microscopic receptor, and yet so flawed that it attacks its own body. It's a powerful reminder of the incredible complexity and the delicate balance that keeps us all moving, breathing, and living every single day.